Mathew Mathison, you're the CAO of our county, Mariposa, Fremont Hospital.
John C. Fremont Healthcare District, yes.
Yes. And we have a couple of issues that have come up with regard to our hospital. And a couple of questions have been asked of me, and I was wondering if I could ask you.
Sure.
This one document breaks down the costs for home health
Yes.
and hospice. And first off, I want to ask, is any of this information confidential?
No, it's public information available, and that's why at the meeting I passed that information out, and everyone was able to take it with them, and it's also been posted on our website, and all of our financial information here is open information, and we present it quite, I think, generously every month at our board meetings.
Okay. Well, if I step into any confidential areas, I hope you'll raise your hand.
Really just patient information, and then employee-specific information is the areas that are protected.
Okay. That takes care of one of the issues. This report covers two areas of service that you were recommending that John C. Fremont Hospital get out of.
Yes.
Hospice and home health. And of course there's was quite a public reaction.
Mm-hmm.
People didn't want to see this go away.
Of course, yes.
And can you, it looks like in those numbers that home health actually makes money, but home health loses money, but hospice is actually making money. So why not just get rid of the program that's losing money?
Well, first of all, let me just say I understand why that these are valued services to this community. So it was not an easy decision to make, but at the time I felt an important financial decision to make. However, to explain or to give shed a little bit more light on the specific financials for each of these two departments. For a hospital of our size and for a home health and hospice departments the size that we have here, they're not completely separable. In other words, we have a lot of people that overlap. They work in both of those departments. And we don't have those people clocking in and clocking out when they're working in each of the departments. So many of those salaries are booked, just all of them go into home health. So that's why it looks like one makes money and one loses money. They both lose money, it's just home health loses quite a bit more. And that's just the way that reimbursement is set up, that hospices are set up to reimburse better than home healths are. So
in most businesses, we provide services and we charge what it costs. That's not necessarily the case with this program,
Right.
These programs. That's not necessarily the case with many hospital programs. Can you explain that a little bit?
Certainly. When it comes to home health and hospice specifically, most of these patients are Medicare patients. And so Medicare says this is what we will pay you for the care of this patient. They don't look into or consider what our cost is to provide that care. They just have a set rate that they pay us. And if we can operate within the limits of that reimbursement, then it's possible to make money, or some places could make money. But the reimbursement for us is low enough that it is very difficult. And unlike other areas of the hospital, home health and hospice is not cost-based reimbursed by Medicare. Our hospital itself, like emergency department, that sort of thing, Medicare does a cost-based reimbursement every year. But for home health and hospice, that is a completely separate, those are separate programs that are outside of that. And so Medicare just sets a rate that they pay us.
Can you tell me a little bit about how other hospitals provide this service?
Fewer and fewer hospitals do this anymore. It really has gone to the specialized agencies that only provide this care. I'm not aware of any hospitals. I'm not saying that there aren't hospitals in California that don't provide it. I'm just not aware of them. And like I said, it's fewer and fewer are doing this because it's very difficult for a hospital to make money. It is a specialized service that agencies that do this and only provide these services, and only these services can do much more effectively and efficiently than a hospital can.
Is there any thoughts about how you could cut costs to reduce the losses?
Well, certainly we're going to look into that, because even though the recommendation from the admin team was to close the departments, the public reaction to that was that this was too important. These services were too important for us to close, and so the board heard the community's voice and ask administration to continue providing this care. So we are continuing to provide it. We are taking referrals and adding patients right now. And one of the things that we're going to have to do going forward is look to see how we can be more efficient. Not that we haven't been doing that in the past, but we're going to have to get more actively involved in that, how we can be more efficient.
Most
in
of the costs in this regard, travel and with respect to home health, I presume, and even hospice, travel reimbursements and personnel costs.
So yes, in any medical business, whether it be a hospital or home health, hospice, that sort of thing, most of the cost is the cost of the people. And if we have to use contractors or travelers, that makes that cost even greater. And again, it's not cost-based reimbursement, so that makes it more and more difficult for us to fit within. So obviously, the more staff that we can hire and eliminate the traveler positions, it certainly helps reduce the cost while still providing the same level of care. And we have had several travelers in here in these departments over the past few years, so we will, I guess, continue to look to see how we can operate them more efficiently financially.
Okay. Speaking of budgets, another handout that was presented at the meeting, or my wife brought home from the meeting, is a comparative cost and loss report from various hospitals. And supposedly they're rural hospitals.
Yeah.
And it shows John C. Fremont losing a lot of money.
Right. This is not a report that I produced or the district produced. I think it was just someone that came to the meeting, handed it out. It looks like a list of hospitals that are identified as rural hospitals. I'm not sure how they did that, because some of these, I know where these hospitals are and they really don't fit rural. But regardless, what it does show is that most of these hospitals making money, and then a few of them losing money. One of the hospitals losing money on this report is John C. Fremont, yes.
Is there a reason why we look so bad on this report?
There is one obvious reason, and that is that the years on this report are 2019, 2020, and 2021. So you have 2019, which was pre-COVID, 2020, which had about 4 months, 3.5 months, or 4.5 months of COVID. And then 2021, fiscal 2021, which is all within COVID. And when I talk about fiscal years, I mean that runs from July of one year to June of the other. So the fiscal 21 year here that shows John C. Fremont losing a lot of money, that was the year in which the federal government gave a lot of COVID relief money to hospitals throughout the country, and we at John C. Fremont received quite a bit of that as well. We have not finished auditing the 2021 financials yet, so we have not brought that money into the bottom line. Once that money is brought in during the audit, our bottom line will improve significantly. Maybe not as much as many of the other hospitals on this report, but I think all of the hospitals, or nearly all of the hospitals on this report, show such good financial performance in 2021 because of that federal assistance that helped cover those losses that we all experienced when COVID hit.
I think that pretty well wraps up my questions.
Okay.
Do you have something you'd like to share with us that I didn't think of? Maybe?
Just that the team here at John C. Fremont is really an excellent team from top to bottom. The staff we have here taking care of you, and we do take that responsibility and that mission seriously, and we're always continuing to improve the care, both the medical care and the customer care that we provide to you. So we are your community hospital, so we're here for you when you need us.
Has any of your cost-cutting efforts affected the operation of the Ewing Ring?
No, it has not. The Ewing Wing has just recently, we have been required to reduce the number of patients or patient beds that we have there. But that was a regulatory issue, and we're working to deal with that. But that's not a cost-cutting thing. That is something that CDPH came in and did a survey, a CMS survey on us, or for us, which they do regularly. I think it's annually that they come in and survey the SNF. And there was some new regulations that we have to adjust a little bit so that we're complying with. But the quality of care that's provided in there is still as excellent as it always was, and it was not a cost-cutting effort. That was a requirement by Medicare that we make that at least reduction, at least temporarily.
I'm glad you clarified that.
Sure.
I have a couple of friends that are staying with you.
That they are. In some ways, they're classified as patients, but the people that we care for, the members of our community that we care for in the Ewing Wing, are more like family members because they are with us for a long time in many cases, and we get to know them. We get to know their faces, many of them. So it's an important part of the service that we provide here. And again, any reductions there are not cost cutting; that is regulation.
Thank you.
You're very welcome.
I appreciate your time, and I know you're really busy, and taking a few minutes with me and clarifying these issues are helping all of us be better informed citizens.
It's my pleasure, Bob. Thank you.
Bye-bye.